everyone, I'm Dr. Alek and welcome to the Ask Dr. Alek show. Basically, this is where you ask and I answer. I'm not sure if everyone saw that image that I posted on Facebook where we had a photograph of a woman and a man, and basically it was clear normal skin, and the next image next to them was all their melanin. It was like this dark mottled brown areas on the face. Those were taken with very specific camera systems that have the ability to see what's happening below the skin. It's basically what we can't see with the naked eye. And that's the focus of today's show. Is I want to show you the VISIA camera system, because it has the ability to see things below the skin, which gives us an insight of changes that will take place to the skin in 2 to 5 years' time. And why that's important is that skin analysis will then allow us to set a proper skincare regime that will help to prevent those changes from actually ever being seen. And so that's the best approach for your skin, as opposed to treating something that you see on the surface and then you treat it, and then when something new happens, you treat that as well. We basically will be able to provide a regime that will treat not only what's on the surface, but what will still happen in the future. So it's very simple. It's an easy process. When you go to your doctors, you will see there's a booth like this. There are 3 very bright lights that will go on. You'll put your chin in here, your forehead against here. It doesn't hurt at all. You close your eyes. There'll be 3 bright flashes, different colors. And that then has the ability with that camera system to analyze with the software. And what it will do, we can see over here, it will basically analyze the skin in 8 different analysis tools over here. The first one is spots. I'm going to add the mask. And what it also does is it gives the actual percentage value. The higher or closer you are to 100%, the better it is for your skin. And what we're looking for are the lower scores. Here we see 56 and 46 and 49%. And so those are the ones that we need to concentrate or focus our treatment for this particular person's skin. Now, spots are fairly high score is given. They're not that many, and that's any irregularities on the skin. We can see wrinkles, also high score, 75%. They're highlighting the crow's feet. These are the things we can see with our naked eye, and obviously we can focus our treatment. Texture on this skin is really good, but it's a little bit more pronounced or in a lower form here on the T-zone area. So we know that we'll have to concentrate our topical treatments to address this T-zone area. Pores are also very, very good. Very few pores on the rest of the face, except again in this T-zone where we expect in most of us to have that kind of picture. And again, we'll focus our treatments on this area, whether it's topical, whether it's a chemical peel or laser. Now, UV spots shows us damage that's just below the skin. That's something that's going to be seen in 2 to 5 years' time. We can see there's a distinct difference in the appearance of the skin when we look without the UV damage being shown. You can't see that damage, as much damage basically with the naked eye. But as soon as you go below the skin or a little bit deeper, we can actually see all that UV damage that's visible. So we know we need to really focus our treatments to manage this quite aggressively to prevent it from being visible and to cause excessive aging in the future. Brown spots is the degree of melanin and the reaction that the pigment can take place with sun exposure. One can see that there are fairly lighter brown and more darker brown areas. And again, this will also have to be addressed. Now, red areas will be of interest to those people that suffer from sensitive skin, where it flares up or goes red for no particular reason. And these areas here around the nose and around the cheek, which are a brighter red than in any other area, indicates that this area could become sensitive with certain stimulations. And so again, we need to focus our treatment to calm the skin and maybe even consider laser to reduce those vascular components within the skin. And the last one, a very interesting analysis, is porphyrins. What porphyrins are is the amount or the degree of bacteria that are on the skin. And what this analyzes is how good your face wash is for your particular skin. And this is a very good score. It's 82%. This particular person is using a really good face wash, which suits their skin. And so this answers the question that we had previously. Am I throwing my face wash money down the drain by just washing it away off my face? Not if you're using the right one. If it's controlling the bacteria and the impurities that accumulate on your skin, the face wash is the right one. And this is a good system to test that. Okay, so basically that's the end of today's show. VISIA system, obviously we can't list every single doctor in South Africa that has it, but it's distributed by a company called Genop Healthcare. Their webpage, I believe, is genop.co.za. They will have a list of all the doctors there that provide, and if not, you can actually contact them and they will be able to tell you which doctor closest to you will have the VISIA machine. Great way of analyzing the skin, great way of then understanding what your best topical treatments and other treatments should be. So thank you for listening. Thank you for listening. It's been great. We've had an amazing year. Please look after yourselves and remember, take care of your skin. Thank you. Bye-bye.